Hi, I'm Dr. Olga Pinkston, a board-certified rheumatologist and the host of the Mind Your Fibro podcast. This podcast is dedicated to fibromyalgia. I discuss up-to-date information about fibro, its treatment, the biology and psychology of the fibromyalgia. I cover the pain science education, the complementary and alternative methods available to you now to improve your symptoms. There are a lot of things that influence development of fibromyalgia, trigger fibro flares, and produce other symptoms like IBS or irritable bowel syndrome, depression, and anxiety, and none of them are your fault. In the Mind Your Fibro podcast, you will learn how and why fibro develops, how chronic pain changes your brain, and most importantly, that you're not alone in the struggle, that fibro is real, and how to not let fibro control your life. This podcast provides information only and does not provide any medical or psychological services or advice. In the last 3 episodes, we covered a lot of information about fibromyalgia. What is fibromyalgia, who gets it, how fibro is diagnosed, and a brief overview of the treatment. Now, in the next few episodes, I plan to discuss the foundation of fibro pain treatment with how to address the brain processing problem. I think it will take several episodes, so before I dive into that, I want to add an episode about what you can do today, now, to help yourself with the fibro symptoms. We're going to talk about the basics of self-care. Now, self-care is important in every condition, and even if you're healthy, self-care is foundation of your well-being. So we're going to talk about 4 things that you need to do to feel better. But before we start, I want to tell you a story about one of my patients that I saw in the summer of 2020. Her name is Mary. It's a fictional name. So Mary came to see me because of pain all over. She was referred to me by an orthopedic surgeon who was treating her for several years for her chronic knee pain. She had a remote injury and the knee continued to hurt since that time. Now, Mary was in her 50s. She had a job. She had family. And when she came to my clinic, she was complaining of exhaustion, brain fog, and pain all over. She had symptoms of fibromyalgia, and after evaluating her, I confirmed the diagnosis. We had a visit about education about fibromyalgia, what fibro is, and approaches of what she can do to treat herself. Now, typically, I do not follow patients with fibromyalgia in my clinic who do not have a rheumatologic condition. And we checked the labs for this patient, and her rheumatologic workup was normal, but she had several vitamin deficiencies. Her vitamin D was low, B12 was low. So typically, if I diagnose and treat vitamin deficiency, I see them back for follow-up. So Mary had low vitamin D, B12, but we'll also discuss her nutritional status as well as stress. And she was under a lot of stress. Her job was potentially going away due to pandemic. She had several issues in her family that were stressful, and she relied mostly on takeout food and drive-thrus for nutrition for meals. She drank mostly soda and coffee, and she relied on a lot of caffeine to stay awake. So we talked about how we can overhaul her health from a nutritional point of view, because I thought the vitamin deficiencies were part of overall lifestyle deficiencies that she had. You know, she was not drinking water. She was eating a lot of processed foods. And so we addressed her nutrition as a first step of her well-being. So she, after seeing me, she left and she came back 3 months later, and she told me that her pain was gone. She was ecstatic. Her fatigue improved. She lost 15 pounds, and it was an unbelievable result. And I can tell you, this result is not typical. Her story is not typical. But she was happy. She stopped drinking soda. She cut down on caffeine. She still drank coffee, but she limited to a cup or two in the morning with no artificial sweeteners or creamers. She started drinking a lot of water. And she stopped going through drive-through and takeout. She started to cook at home and bring her lunch to work. So she made a lot of changes. And she told me, I'm in my 50s and I heard those recommendations before. Many doctors told me, eat better, move, drink water, but I did not think it was important. And after feeling so poorly, and I decided to, why not? Why not try it? And I have unbelievable results in 3 months. So I was extremely pleased and happy for her. We checked her vitamin levels. Her vitamin D was in normal range. B12 improved. And she left, and we did not plan on follow-up because she was doing so much better. The old injury was still hurting, but the overall pain and discomfort that she come to see me for was gone. Well, fast forward 3 more months. It's January 2021, and Mary is back in my office in tears. Her pain is back. She feels fatigued, exhausted, and completely devastated. And what happened? The holidays were stressful, and she lost her job, and the family Christmas and holidays times were stressful, and she went back to her eating habits. She quit her water drinking first, and then she started take out more because she was more tired, and her pain came back to the same level as it was in the summer of 2020. So I can tell her initial result, no pain in 3 months after improvement of, her diet and mindset was remarkable, but not typical. But what I can tell her follow-up visit in January was very typical. Many of my patients have the best intentions to start a diet, to start eating healthy, to drink water, move, exercise, and then they come back and they're not feeling well. They did not follow through with their intentions. Now, many of us, with January coming around the corner, we are planning to overhaul our health. We are planning to improve the diet or lose weight or exercise. We join gyms and buy diet programs and treadmills and Pelotons. It is a normal desire to improve our health. But the maintenance of it, especially if you are a patient with fibromyalgia, is difficult. Patients with fibromyalgia respond very differently to stressful situations. Feel they're more sensitive. They don't have reserve. When they're under stress, the pain comes up more strongly than in somebody who doesn't have fibro. They're more emotionally connected to their bodies. So when they have an event that is stressful or devastating in subtype, so they may not be able to handle it as well as somebody who doesn't have fibromyalgia. So even though diet and exercise and overall lifestyle modifications are very important, recognizing that those modifications will add additional stress to you if you don't know how to maintain the consistency. So fibromyalgia treatment plan is not going to be successful if you're not consistent. I'd rather for you to do less but be consistent than overhaul your entire lifestyle and just quit in a few weeks. So today I want to give you a few tips of what you can do today that are not complicated, that are easy to do, but will make a huge impact on your fibromyalgia symptoms. Those modifications will improve your fatigue as well as pain. Number 1 is proper rest. Number 2 is sleep. Number 3 is diet. And 4 is stress reduction. So proper rest, when I talk to my patients about resting. I often hear, well, I am resting enough. I'm napping, I'm in bed, I'm not moving, I'm on the couch. How much can I rest more? And what I see from many of you, you're not properly resting for fibromyalgia. Now, fibromyalgia brain is extremely sensitive to stimuli. It is a toddler brain. The toddlers get excited very easily. They get overstimulated by positive and negative emotions. If you've seen a toddler going to a birthday party, you know that it's a happy event, but it wears a toddler out. He gets into a tantrum, or he gets into crying. He feels exhausted after having a cake and excitement of seeing their friends. So even though activities can be happy, they will wear out the brain, and the brain needs to recharge. So when you're taking a bubble bath or an Epsom salt bath, if you're watching television or surfing Facebook or other social media, if you're reading a book or talking on the phone, those are low-level activities, but they're not rest. So you need to change your thinking about how you rest in fibromyalgia. In fibromyalgia, rest is equal to recharge your brain batteries. You don't want to multitask. You want to stop whatever you're doing and rest your eyes, close your eyes, hopefully in a dark, quiet room, and have no stimulation of your brain. No talking, no outside world like television. You want to have a quiet place. Now, some people may benefit from meditation or prayer, but you want to have 10 to 30 minutes of quiet time with your eyes closed. You can either sitting down or laying down, but that will be a time when you recharge your brain by avoiding stimulation. If you do it 2 or 3 times per day, you will see improvement in your fatigue and overall reduction of downtime. Now, other types of rest is important, but it's not the same as fibro brain rest. The next is sleep. Improvement in sleep quality will improve the brain fog and fatigue as well as pain. Many patients with fibromyalgia have sleep disorders, either sleep apnea or insomnia, or they sleep for many, many hours, but they wake up unrefreshed. Sometimes patients don't go into deep sleep. There are many reasons why sleep in fibromyalgia patients is difficult. There are many ways you can improve your sleep. Sleep hygiene is very important. Having the set time when you go to bed and a set time when you wake up is important. Also, not watching television or not having any kind of digital stimuli at least an hour or two before bedtime will improve quality of sleep. Relaxing activities such as reading, meditation, journaling will benefit you. Not staying in bed if you can't fall asleep, meaning if you can't fall asleep within 10-15 minutes, get out of the bed, do something relaxing, and then go to bed to fall asleep. Sometimes drinking tea, like sleepy time tea, or some relaxing tea blends that are not caffeinated can relax you and help you fall asleep. I recommend you seeing your primary care physician or sleep specialist to discuss sleep issues. And also, if you have sleep apnea that's untreated, it is in your best interest to treat your sleep apnea. Sleep apnea is a condition that affects not only sleep, but also other organs such as your lungs, your heart, also your brain. So untreated sleep apnea causes many health issues if left untreated. The next thing I want to address is diet. Now, I'm going to have a special lecture on diet. I'm planning a webinar to discuss the dietary changes that fibromyalgia patients can do to improve their symptoms. So watch out for the mailings on that. I think nutrition is extremely important for everyone's health, regardless of what diseases they have or if they're healthy. In patients with fibromyalgia, I think nutrition is even more important. Patients who have chronic pain and fatigue are often stress eating, comfort eating, or overeating because they don't feel well. Unfortunately, most of the foods that they overeat or stress eat are loaded with sugar and carbohydrates. The simple carbs, flour, and sugar dominate their diet. I see many patients who eat bread and pasta and sugary sweets nonstop all day. Also, they drink a lot of soda, both regular soda or diet soda, sweetened tea, juices, and often drink very little water. Now, if this doesn't apply to you, I applaud you. I know many patients with fibromyalgia make dramatic changes in their diet. So if you're already not drinking soda or sweetened beverages, it's great. But if you are reducing these sweet drinks, even if they're artificially sweetened, soda, diet or regular sweetened tea and juices, and you will see the benefit in terms of fatigue and pain. I can tell you, I have many patients who have, for example, rheumatoid arthritis, who are taking multiple medications for that, and they cannot improve their hand swelling or joint pain until they cut out soda. I have one patient in particular who was on 3 medications for rheumatoid arthritis, and he was a heavy Mountain Dew drinker. He drank almost a case of Mountain Dew a day, and I could not reduce his swelling until he stopped drinking Mountain Dew. Within a week of stopping all soda, his swelling went away. Now he went back in a week to drinking one bottle of soda back, one bottle of Mountain Dew, and his swelling came back to the same degree. So I can tell you, this is my biggest plea to all my patients: stop drinking artificial drinks, soda, Cokes, pop, whatever you call it. It will benefit your health. The other thing you will see if you improve consumption of simple sugars. Now, sugar is processed carbohydrates raise your insulin level. They contribute to obesity. They contribute to inflammation, and also they produce a lot of craving for simple carbohydrates and sugary foods. So if you're unable to cut down on soda, it is likely because you're consuming simple carbohydrates, or if you cannot cut down on simple carbs, it's because you're consuming a lot of them. I can tell you, many of my patients have a very typical diet. For example, they will eat a bagel with cream cheese for breakfast, with a banana and orange juice. For lunch, they'll have a bag of chips and a sandwich. And for dinner, they'll have a bowl of pasta. Now, overall, you will say, well, this is not a bad diet. It's not horrible. But they're not consuming enough protein, fresh fruits and vegetables, and they're consuming a lot of carbohydrates in the form of bread, sugar, and flour. So if you're thinking about improving your diet, don't overhauling your entire diet plan and having a very restrictive diet. Reduce simple carbohydrates first. Reduce the sugar, the flour, and eliminate soft drinks. Also, increase your water intake. Water is life. Unless you're a cactus and living in desert, you need water. And water you can drink in forms of tap water, regular water, bottled water, sparkling water, unsweetened tea, unsweetened coffee, anything that's liquid that doesn't have calories, doesn't have sweeteners, you can count as water. Now, as you improve your water consumption, you probably will start drinking more water in general and without supplementing it with the flavored drinks. Most patients need at least 64 ounces of water per day, which is 8 to 10 cups a day. And I can tell you, most of my patients do not drink that much water. Now, the last thing that you can do for yourself is to reduce stress. Now, it's easier said than done. Stress is everywhere. We're stressing out about traffic and pandemic and our children and finances and holidays. But being mindful of the amount of stress that you have and trying to reduce unnecessary stressors in your life will benefit you. I will have a podcast episode just about how to reduce stress and also how stress affects your pain and fibromyalgia symptoms. So this will be covered in a greater detail in the future episodes, but I want to encourage you to be aware of your stressors and be aware of things you can do daily to eliminate them. Now let's summarize. Self-care in fibromyalgia is very important. And there are simple things you can do today to improve your symptoms. I suggest you improve your sleep. Add 2 to 3 times per day, 10 to 30 minutes of proper rest for fibromyalgia will be eyes closed, dark room, cold room, without stimulation. Next is improve your diet, eliminate processed sugars and flour, as well as add more vegetables, fruit, and replace artificial drinks and sweetened drinks with water. And the next one is reduction of stress. Being aware of your stressors and trying to eliminate them consciously will benefit your pain level as well as help you maintain the consistency of your self-care, such as diet, sleep, and rest. Now, I know many will doubt these suggestions, and I'm sure all of us heard this at some point. Eat better, drink water, sleep, move, don't stress too much. These interventions may sound too simple and too good to be true. They may be hard to implement, but what I see in my practice is that the lifestyle changes that I described today make a positive impact on well-being. If you recall the 3 pillars or 3 parts of fiber treatment, the education, the self-care, and pain and symptom control, these lifestyle changes fall under the second pillar, the self-care. But they also affect the pain and other fiber symptoms like IBS and fatigue and brain fog. So self-care is a vital component of fibromyalgia and really any chronic disease treatment plan. If you still doubt these changes will work for you, ask yourself, can the opposite be true? Do you believe that eating poorly, being chronically dehydrated, not sleeping well, not resting, stressing out too much, are good for your health? Now, thank you for listening to this podcast. If you enjoyed today's episode, the best thing you can do is to share with someone and leave a review and rating. This helps me support more people just like you move toward better life with fibromyalgia. All you have to do is to go to the platform you're listening on, click the share button or the icon, and just send it to a friend. I so appreciate you taking your time to do so. Make sure you sign up or subscribe to this podcast so you can get the most up-to-date information in the new episodes. Thanks for joining me today, and I will see you next week. And don't forget to mind your fibro. Disclaimer, this podcast provides information only and does not provide any medical or psychological services or advice. None of the content on this podcast prevents, cures, or treats any medical or mental condition.